Hi, welcome to Advanced Heart and Vascular Center of New Mexico. Dr. Amanda Ryan, your friendly Carlsbad interventional cardiologist, as well as Jennifer Tupper to my left, my nurse practitioner, and Missy Richardson, our other nurse practitioner to my right. We've had a lot going on with Advanced Heart and Vascular Center of New Mexico in the last few months. We've expanded our practice to Artesia. Jennifer's seeing patients on Tuesdays, Missy will start seeing them on Wednesdays, and I've been seeing them on Thursdays. We've also expanded our practice to Roswell in conjunction with Lovelace Hospital. We're doing quite a few procedures at Roswell Lovelace, as well as having clinic there. We'll expand to Hobbs starting July 11th. Missy will be there, and then I'll be there on July 15th. So you can call our office at 575-941-4400 here at 2405 West Pierce in Carlsbad to schedule appointments for any of your needs in any of the locations. You can also go to our website at AHVNM.com to schedule any appointments. Construction is progressing with our mansion on the mountain, which will be Surgical Suites of Carlsbad. Again, we're hoping for it to be ready in early spring. I was on call actually up at Roswell Lovelace Hospital this past weekend. We got called in for about 6 emergency cases. We were able to help patients from Lovington, from Hobbs, from Roswell, from Carlsbad, and from Clovis. So you might wonder, and I'm sure some of you have realized how busy we really are as a practice, but how do we make this practice work? What is our model for truly providing the kind of care in our rural area that the patients really deserve? And the way we do this model for us is that the nurse practitioners and myself work in conjunction to help care for all of your needs. So Jennifer, tell me a little bit about if I get called to an emergency at any of our local hospitals, how do you step in and participate?
If Dr. Ryan happens to be called out, usually myself and or Missy, whomever happens to be with Dr. Ryan, will step in to provide care for the patient. Part of the ideal is transparency between myself and Dr. Ryan. If something is going on that is critical or needs consult, that she's very readily available. So it's nice to have shared knowledge between all of us and to have some commonalities in treatment.
And Jennifer, you have a little special interest in heart failure. Tell us a little bit about that.
It comes from experience in my own family and having family members who have had episodes of heart failure, so to speak, which is just a real fancy way of saying you've got lots of fluid overload, not that your heart is stopping essentially or going to quit working. Heart failure in general is multifaceted and encompasses several things. So it's nice to be able to sit down one-on-one and have consult with Dr. Ryan as to here's what I'm seeing, here's the usual treatment and guideline-directed medicine, but what can we do to tailor to our patients and make it truly patient-centered care?
Definitely. We also have a good relationship with Dr. Nair in Arquetta that work with Dr. Paoni over at UMC in Lubbock at Texas Tech, and they have an advanced heart failure program there. So we often get our patients to that practice as well so they can further guide our care. And Missy Richardson, who's joined our practice again. Missy has a really vast experience as both a nurse and a nurse practitioner. She's worked in cardiology and CT surgery and primary care. She's worked as a hospitalist as well as an emergency room provider. And of course, Missy brings other things to the practice too. If I could list everything that these two really bring to our practice, the video would last much too long. So they bring a lot of great skills as well as amazing personalities. Missy, tell us a little bit about what is one of your unique skill sets?
So everybody around here really enjoys the fact that I speak fluent Spanish and I'm able to communicate with our patients on a regular basis so that they can understand totally what's going on with their health.
And how did you learn to speak Spanish? What was your motivation?
So the motivation for that is I was actually working at a hospital in El Paso, Texas, where Spanish is the majority of the language that's spoken. And you get immersed in that and you learn it much more easily. And again, it just helps you communicate with everyone around you.
So the comfort level that Missy's really able to give our patients, we have several fluent bilingual staff members. Having a provider that's also bilingual has really increased our ability to reach our Hispanic population, which is really important to us in this community. So we just wanted to give you guys some updates. We are proud of who we are and what we represent. We will continue to represent the entire southeast region of New Mexico in bringing advanced cardiovascular services to your area.